Now, here's an interesting debate because desperate patients are now really worried they may have to wait even longer for emergency services after the National Health Service launched electric ambulances. These ambulances apparently will take 4 hours to recharge, and they're limited, of course, in their range. So today we're asking, should the NHS be worried about going green, or shouldn't they just think about patients first? Joining us now is the Director of Climate Media Coalition, Donnachadh McCarthy, and the NHS Trust CEO, Dr. Peter Carter, OBE. Thank you very much for joining us. Let me put that question to both of you, maybe Donnachadh first. I mean, is it the job of the NHS to be thinking about going green?
Of course it is. Looking after the having cleaner vehicles means, of course, that the air in our cities will be cleaner. Up to 30,000 people die prematurely every year from air pollution in the United Kingdom. So it would be ridiculous for the NHS to have vehicles when it can have cleaner vehicles. So moving towards electric vehicles makes sense. This scare story in the media about delays to ambulances, it's saying is if they are used in rural areas. And we have to remember 83% of the UK population lives in lives in urban areas. And so the first rollout of electric ambulances is for those areas. So the scare story shouldn't be paid attention to. And the second major reason why the NHS should be taking care of this is because of cost. They're estimated the switching to electric could save £60 million a year, which would buy 400 new ambulances. And the third reason why is that if we go above 1.5 degree rise in temperatures, the WHO has said it's the greatest health emergency ever to face humanity. And tropical diseases are already crossing the Mediterranean. Some of them are already at Paris. And if we have tropical diseases in the United Kingdom, it will absolutely trash our quality of life.
Peter, let's see if you can answer that as well. I mean, is it the job of the NHS to worry about going green at all?
Well, it is, Anne, but can I just first of all say I'm not the chief exec of the NHS. I'm an independent healthcare consultant, so I'm sorry your people have given you a slightly wrong briefing, but I have been an NHS Trust chief executive and I've been an interim chair of a number of NHS trusts. Look, I think it's absolutely essential that the NHS takes on the green agenda. It burns a huge amount of energy. It's the biggest of all our public sector services, and we have to take this very seriously. Where I think the NHS goes wrong, if you take the issue to do with these ambulances, I wish that we'd get the communications better and publish the evidence and demonstrate, as your previous speaker has said, where are these ambulances going to be used? Because certainly if they're used in urban areas and inner city areas, there's not going to be a problem. Currently, there would be an issue in some rural areas, but that's actually a tiny amount of the usage of ambulances. What we hear from nurses is that there are huge problems with saving energies. For example, outpatient clinics, they often find it difficult to turn off the lights or the television screens that have been on during the day because they're on time switches. And you walk around any hospital at night and you'll find corridor after corridor are still lit during the night, even though they're not being used. So I think the NHS has a huge responsibility in taking all of these issues with the utmost seriousness.
I think everybody is always worried, though, that something new like that, like trying to be as green as possible, just creates a new department within a hospital or a trust with a new department head. In other words, yet more bureaucracy. How do you get around that one? Donnachadh first.
Well, in any business, to actually reduce costs, you have to invest. And you can't actually organise the replacement of the heating systems and lighting systems with nobody doing it. For example, when I visit my consultant, we're in a small room. They have old-fashioned lighting on the ceiling, and I actually counted the number of bulbs. There were 14 bulbs, and they were using the equivalent of 28 rooms worth of electricity. That's insane. So it's really important we have the NHS moving to efficient lighting to save us money and to then reinvest that money in nurses and doctors and frontline services. But you can't do that without somebody there overseeing the purchasing of the new products and installing them. It's a huge logistical task to replace the heating systems and the lighting systems. And I'm really pleased it's doing it because it's a win-win. It'll reduce costs and protect our climate. What's the issue here? I think the issue here is the Telegraph is having a war on protecting climate, and I want to know why.
Peter?
Yeah, look, I agree with Donnachadh. You've got to invest to save. And what you need to do is you need to buy in experts on being energy efficient. And also the NHS needs to show the data on what the return is on the investment, and to demonstrate by spending some money, ultimately you're going to save money. And really, every hospital in the country should be on LED lighting. Should have been a long time ago, and some hospitals are doing it. But the problem is it's not uniform across the 4 countries of the UK, which burns a huge amount of energy. And this is what I think you need to buy in specialist experts in order to demonstrate that by investing, you will end up saving money.
Another example of this is heating. How many times have you been in a hospital, Anna, when the heating is just absolutely sweltering? Quite often, the nurses and doctors can't turn down the temperature. It's at 23 degrees. What does 23 degrees mean? It means 50% on the heating bill. Yeah. And how many hospitals are we in where you see the windows wide open because the nurses are sweltering? That's bad for the cost for the NHS, but it's also bad for patients, and it's really bad for the health of the staff working for the NHS.
Yeah, why is that? I mean, it's funny you should say it, but I think everybody's going, yes, absolutely. You go into a hospital, the places that don't need to be warm are roasting sometimes. Why are those systems there, and are the nurses and doctors unable to actually just sort of alter them?
Because
do either of you know?
Can I come in and say, look, I mean, let's be clear. There are some hospitals that are really well run, and they do this sort of thing in the way that we would all wish. The difficulty is you've got to get a uniform approach, and you've got to get that deep into the NHS so that everybody is thinking the green agenda. And that's why I say I think that the NHS should get their comms better. But also, they should be saying to people, where are your returns on this? Can you demonstrate what you're doing to get us more energy efficient? And who on earth wants to see the taxpayers' money wasted in a way that detracts from patient care? Get the energy efficient right. As Donnachadh's just said, you will be able to invest more in nurses, doctors, physios, and other related clinical staff.
Very briefly, then, a final word from you, Donnachadh.
Yeah, the reason why many hospitals are overheated is that they're old-fashioned systems without zoning controls. So you can't set the temperature, you can't turn it off in parts of the building that are occupied. It's happening to loads of buildings across the country. I work with many charities and I see the heating's on morning, noon and night, wasting our money and wasting money that could be invested in services for the public.
I'm working in one right now. It's absolutely roasting in here and nobody seems to know how to make it cooler. Thank you so much, gentlemen, both. Thank you.